Goldman and colleagues report important new data on the neural correlates of attention deficit hyperactivity disorder, ADHD. This is an MRI-based study that collects information on brain structure from literally thousands of individuals. And there are a couple of important take-home points. The first one is that the volume of the brain's surface area is the variable that most potently relates to the ADHD diagnosis. The second is that the neural correlates of ADHD vary with the age of the individual. There are quite substantial correlates among children with weaker correlates in adolescents and adults. And then finally, in this study, which is particularly large, gathering patients from all over the world, we see that the magnitudes of these differences in brain structure are not large. And this tells us that we still have considerable work to do before a structural brain imaging measure will be clinically relevant for the diagnosis of ADHD. Licker and colleagues examined the degree to which we can predict the onset of dementia among elderly individuals who are at risk. And there are a couple things that are particularly important about this article. One is that the data are collected prospectively, similar to how things might work in a clinic. So we look at how variables at one point in time predict risk for the future. The second important point concerns the range of factors that are examined here. So there are clinical and demographic factors that readers will readily recognize, but there's also imaging and genetic factors. And then the third important thing to note is that we see the beginnings of tools that clinicians can eventually use. So we're not quite to the point where the measures in this study can be clinically useful, but this study is an important step to getting to that point.